This child has phenylketonuria, or PKU, a rare genetic disorder discovered in 1934 that affects 1 in 15,000 babies. In PKU, normal dietary proteins can cause severe brain damage.
There are over 8,000 different kinds of enzymes. Each of them has a job to do. If you've got PKU, one of those enzymes isn't doing its job. And what that job is to convert a particular amino acid that occurs in almost all kinds of foods called phenylalanine. And your body needs a little bit of it, but you get lots more than what you need. And too much of it is a problem. It's actually dangerous for the brain.
In 1952, this young English girl, Sheila Jones, was the first PKU patient to be successfully treated with a new low phenylalanine synthetic formula, which is the standard of treatment still used today. Only now, 60 years after PKU was first identified, do patients have a new pharmaceutical option to help manage toxic blood phenylalanine levels.
PKU has been a devastating disease. And while things are a lot better today than they have been, there's always been a struggle at each stage of trying to improve the science and improve the treatments. There's always been a struggle, and it's usually taken very persistent parents to push the system, to push the doctors, to push the government to make a difference.
Today, all newborn babies in Canada are given a simple blood test at birth for PKU so that they can be treated as soon as possible, without which indetectable neurological damage occurs, and parents don't know until it's too late.
My wife and I had no clue. I'd never heard of PKU, had no idea we were carriers.
We felt very bad. We haven't a clue of what PKU was until she was diagnosed.
It was devastating. We were really upset. I mean, your initial response is to cry because it's overwhelming.
Okay, Derek, it's time to make your juice.
Glenda's son, Derek, is helping to prepare the formula he needs to take every day.
Because your body can't handle this one amino acid, but you need other amino acids, you need protein, you have to take special formula, which is synthetic and has hopefully all the other elements, amino acids and other minerals and trace elements that you need. Let's talk about what the fee-restricted diet is. You would start with a vegan diet, and then you eliminate the protein.
That makes full dietary compliance extremely difficult, if not impossible. Fortunately, now PKU patients have a new treatment option.
It's a drug called, official name, cypropirum dihydrochloride, brand name Kuvan, and it doesn't work for everybody with PKU, but for some patients it works well. For some patients it works very, very well.
We started her on Kuvan, and after about 4 months, the teacher came and talked to us because she couldn't understand what happened because her attention was way better. He was concentrating a lot more. She was able to do a lot of tasks by herself that before she needed help.
Kuvan has been approved in Europe, every country, in the United States, in Japan, and not just approved for sale, but also approved in many jurisdictions for the public health insurance coverage.
Kuvan is not yet accessible through publicly funded provincial drug programs. Christian worries for his daughter, Candy.
If we have to take her off Kuvan because we can't fund it, the government won't fund it, it's a huge challenge that we don't even want to think about it.
So we have to be persistent parents and persistent patients to move the system so that every patient has access to every treatment tool in the toolbox that works for them.
If you know something is helping your child's brain develop, you certainly don't want it to stop.
What are you drawing?
If his brain is going to be compromised just because he needs a drug that the government is not willing to pay, I just don't think it's fair.
The existing treatments, the traditional treatments have been good, but they haven't been great. All right? Now we have the chance to raise the bar for a whole bunch of patients to get better health, a more natural diet, a less synthetic diet, a less rigorous diet, and where we'll have better learning outcomes and we'll have better health outcomes, and these people will grow up and be more productive contributors in society.